Stuart had some chronic issues with neck and back pain that had always responded well to conservative therapy. When the more severe episode happened, he woke his owners one night crying, went outside and wasn't able to walk after that. Shortly thereafter, he had an MRI done which identified 2 areas of compression in his lumbar spine. Following surgery, he came here for rehab.
Today I'm going to talk to you about intervertebral disc disease. So essentially, intervertebral disc disease means that you have a disc between each one of the vertebrae, right? And in chondrodystrophic type dogs, and those are dogs that are like dwarfs, like dachshunds and beagles, what happens is that disc, instead of being a nice jelly and a shock absorber between the two, vertebrae or all the vertebrae, it becomes more like toothpaste over time. What will happen is that disc will get some damage because no longer can it provide the shock absorption. It gets damaged every time the back kind of concusses together, or the vertebrae concuss together. Is that toothpaste will actually shoot up and hit the spinal cord. So, if you look at this end on, the disc is here. Right here is where the spinal cord is, and the nerves kind of branch off on each side. When that disc ruptures, it will actually go straight up and it'll hit that spinal cord. And once it hits that, it will affect everything behind it. So if it happens in the neck, it's going to affect all 4 legs. If it happens in the mid-back, it's going to affect the back legs. Surgery involves a hemilaminectomy, where I actually remove the wall here, and I'll go into the disc here, into the spinal cord here, and I'll remove the disc, and then I allow the spinal cord to heal. I do not replace that bone. Once that bone is gone, it's not replaced. What will happen is scar tissue will form over there to protect the spinal cord.
Started with Scooter very soon after his surgery, and he had some very intensive rehab. He stayed with us for several days. We started with using the E-stem to try and induce muscle contractions of his rear legs, and once he had motor ability, we progressed more with the balance exercises and eventually to the underwater treadmill.
Initially, he had quite a bit of electrostimulation to his muscles to encourage them to have muscle contraction and prevent atrophy. Later on, he graduated to exercises where we were trying to improve his core, improve his balance, and his proprioception. Once his incision had healed, we actually started him working in the treadmill. Initially, we had to actually move his legs for him to teach him how to walk again. Eventually he regained that function himself. And most of our work now is focused on improving his balance, improving his endurance and his strength in his rear legs, as well as his proprioception, his ability to feel where his body is in space and respond appropriately. We're doing a lot of work with cones and cavaletti rails so that he can regain and continue to improve the function that he had before.